Hi everyone, my name is Jacob, and I'll be presenting the effects of cigarette smoke exposure on diaphragm force function in mice. So the reason why we studied this was because breathing deficiencies are detected in patients who develop chronic obstructive pulmonary diseases, COPD. This is accompanied usually by a decrease in diaphragm force muscle function. Our aim was to analyze the effects of 2 months cigarette smoke exposure in mice and 2 months air exposure in mice as well. We would we plan to analyze the ex vivo diaphragmatic force output. So what we did was get 24 male wild type mice and split them up into three different groups. Vivarium group, which we grabbed straight from the vivarium and euthanized and analyzed the force um, output of the diaphragm after electrical stimulation. Then we had the air exposure group and the cigarette smoke exposure group that were exposed for 2 months. We would put them in these chambers, use these clamps to clamp down the chambers, and there would be a lid on top, and then the air and cigarette smoke would go through these little holes and disperse throughout the chambers. Um, and then the cigarette smoke would go through this tube right here and through the top, and then disperse as well throughout the chamber. After then, we would then analyze the diaphragm um, force strip, the diaphragm strip that I had dissected and measured the force um, muscle contractions after electrical stimulation at 1 to 300 hertz. For the results, we looked at weeks of exposure over time, over the 2 months, and the body weight, um, and compared the air and cigarette smoke exposure groups that were being exposed over the 2 months. We then looked at the final body weight per group before euthanasia. And then we also analyzed the peak isometric force over the pulse frequency um, of each of the three groups. So the vivarium, air, and cigarette smoke exposure at the 1 to 300 hertz electrical stimulation. We then analyzed the maximal force um, for the three groups, and we found the averages and the range between the three different groups and analyzed if there was an effect or not between the groups as well. We also looked at the F50 between the groups, um, which in this figure suggests that the effects of exposure on force are probably due to myofilament force production and not calcium release within the muscle fibers. And for future directions, we plan to perform histological data obtained from the diaphragm, and then measure plasma angiotensin 2 and lung TNF alpha um, measurements. And then we also plan to determine the effects of cigarette smoke and air exposure on diaphragm mitochondrial oxygen consumption, as well as in the future, we plan to perform tracheostomy and insert an endotracheal tube in the mice and um, intubate the mice for 4 hours with each of the three groups and mechanically ventilate them for 4 hours to determine and then determine the the diaphragmatic force output after the 4 hours of ventilation, and notice the differences there as well. Thank you for listening to the presentation. And if you would like to contact me, Jacob Baker or Leo Nogueira, these are our emails right here on the bottom right. Thank you.
This presentation is on 2 months of cigarette smoke exposure in mice, does not affect recovery of in vivo nerve stimulated torque, but delays ex vivo muscle force recovery. Cigarette smoke exposure is known to have many adverse effects outside of the lungs. The use of tobacco products has been associated with greater incidence of muscle injury and slow recovery after strenuous exercise. Our group has shown that muscles from mice exposed to cigarette smoke before COPD development contain fewer satellite cells which participate in the regeneration process, and myofibers have a lower cross-sectional area after lengthening contractions. Our aim was to determine whether 2 months of smoke exposure impacted the initial recovery of isometric ankle torque after lengthening contractions compared to control groups of the same age. PAC7 Cree TD tomato mice were exposed to cigarette smoke 5 days a week for 2 months. After the 2 months of smoke exposure was completed, in vivo torque was measured in both legs, and one leg was subjected to a lengthening contraction protocol. Torque for both legs was then measured again on day 3 and day 7 of recovery. On day 7, the mice were euthanized and the EDL muscle was dissected for ex vivo force measurement performed at 37 degrees Celsius. Figure 1 shows the body weight of the mice during the 8-week exposure. Both male and female mice showed no significant change in weight over time. We found in male mice, weight was lower for the smoke-exposed group compared to the non-exposed group, while in female mice, weight was not significantly different between two groups. Figure 2 shows the results of in vivo torque measurements during electrical stimulation of the peroneal nerve before and after LCP. In male mice, in vivo torque was greater in the CS exposed group compared to the vivarium group. In the uninjured leg and LCP leg, torque recovery was not different between exposure groups. In female mice, the in vivo torque was greater in the CS exposed group compared to the vivarium group. In the uninjured leg, maximal torque was increased during the recovery from LCP. In the LCP leg, recovery was greater in the CS exposed group compared to the vivarium group. Figure 3 shows EDL muscle weight and ex vivo isometric force. In uninjured legs, ex vivo EDL muscle force did not differ between exposure groups in male and female mice. In LCP legs, ex vivo EDL muscle force and mass were significantly lower in the male mice CS group compared to the vivarium group. However, in females, there was no difference between exposure groups. The data we've gathered is significant as they suggest that tobacco smoke exposure not only slows the recovery of muscle force, but also increases nerve-stimulated muscle activation potentially as a compensatory mechanism. These findings have profound implications in our understanding of the effects of tobacco smoke on muscle physiology. In the future, we would like to perform immunohistological data from tibialis anterior muscles to identify and analyze the regenerating myofibers, as well as identify the TD tomato expressing muscle fibers and satellite cells. We would also like to measure protein, mRNA, and cytokines from muscles subjected to LCP. To conclude, we'd like to acknowledge Kyle Dominguez and Kristen Klebel for assisting with the smoke exposure, as well as the tobacco-related disease research program for their support.
Due to a lack of regulations, San Diego's youth are permitted entry into smoke shops. These retailers sell tobacco products and paraphernalia, unregulated intoxicating hemp, hallucinogenic gummies, nitrous oxide, and more. In addition, many smoke shops also function as convenience stores, selling everyday household products such as bread and milk. Without any regulation, smoke shops are operating near youth-sensitive spaces in San Diego, including adjacent schools, parks, and libraries. They have no minimum age of entry, no regulations on advertising, and no dedicated compliance monitoring system in place. Say San Diego has identified 136 total smoke shops in San Diego, nearly 1 in 4 operating within 1,000 feet of youth-sensitive spaces. Data shows the proximity of the smoke shops to youth-sensitive spaces increases youth access to products and cultivates a cultural acceptance of the intoxicating, mind-altering, and/or hallucinogenic product use. Say San Diego is advocating for the regulation of smoke shops to better protect the health, safety, and welfare of San Diego's youth and communities.
Hi, my name is Abigail Baxter Nordskog, and I am the research coordinator for the Tobacco, E-cigarette, and Cannabis Waste Randomized Controlled Trial at the Cannabis and Tobacco Research Lab of San Diego at Cal State San Marcos. And I'm presenting the Tobacco Tracker online tool reports of smoking and vaping and related litter on 2 smoke and vape-free college campuses, opportunities for education. Marijuana and tobacco has been increasing in popularity, and college campuses have implemented smoke and vape-free policies to kind of combat that situation. But despite the bans, these products still remain popular, especially e-cigarettes, which are often marketed as less harmful. The education and intervention can help college students quit tobacco and cannabis products. And enforcement of these policies does rely on education and outreach from the campus community. So this poster looks at 2 campuses that are smoke and vape free, one UC and one CSU that are using a publicly available tobacco tracker to gather campus policy compliance information from citizen scientist reports. So these community members, 87% of which were students enrolled in our educational trial, use the publicly available tobacco tracker from March of 2023 to March of 2024 as part of an ongoing study. The tracker contains 3 main reporting options: smoking and vaping, related litter, smoking and vaping, and looks good, no smoking, vaping, or related litter. So let's look at the total reports. The total reports are 1,287, or 53.2%, where it looks good. And 35.4% were smoke or vape related, 11.4% were smoking or vaping. Let's look at the total reports versus looks good. The number of reports was proportional to each of the campuses, which was pretty good. And the looks good comprised of 58.8% of all reports at Campus A and 50.4% of all reports on Campus B. Total litter reports, litter from smoking or vaping comprised 33.2% of all reports at Campus A and 36.5% of all reports at Campus B. Cigarette butts were most commonly reported waste at Campus A, 77.9%, and Campus B, 90.3%. And then it follows by e-cigarette, and then other, and then looking at the smoking and vaping reports, which comprised of only 8% of all reports at Campus A and 13.2% of all reports at Campus B. So across both campuses, vapor from e-cigarettes collectively of campuses, vapor from e-cigarettes and or Juul was the most common at 40.1%. But when broken down, interestingly, at Campus A, vapor from e-cigarettes was still the leading source, but at Campus B, it was cigarettes, which is kind of in line with their total litter reports. So in conclusion, we are able to present this education at these hotspots. And as you can see, there is a picture of one of our educational posters, Do It for the Squirrels. And then we have our references, and we would like to have a special thanks for Dr. Tom Novotny and the California Youth Advocacy Network for their contributions.
Hi everyone, I'm Cheyenne Smith and I am a lead research assistant on the TCWRCT associated with the Cannabis and Tobacco Lab of San Diego, Cal State San Marcos. And I'll be presenting the tobacco, e-cigarette, and cannabis waste on 2 smoke and vape-free college campuses, public health implications. So some background on this is that the tobacco and cannabis research has often focused on how the usage and exposure of these products directly impacts our overall health and well-being. That includes DNA damage, malignant phenotype, migratory properties, and immunosurveillance, as well as various mental health issues. A lot of the research has been focused on the environmental impact of these products and how that not only pollutes our environment, but also directly impacts our health and well-being. The present study describes TCW on campus of two California universities with smoke and vape-free policies. And the TCW findings are compared by scans in randomly selected campus locations and by scans from citizen scientist reports. And the findings are from March 2023 to March 2024 as part of an ongoing study. So we have a public health research assistant known as a FARA that conducts a 30-minute scan in an area in search of TCW from the reported scans of our citizen scientists. And during these scans, they wear personal protective equipment to collect and dispose of the waste that is found in these scans. And they also conduct a weekly 60-minute scan of a randomly selected location for TCW, which we call a randomized scan. So in the randomized scans, Campus A had a total of 35 randomized scans, which resulted in the collection of 1,168 total TCW products being collected, and the majority of which we have found was 999 cigarette butts. And another outstanding factor that's being found in there is 105 other, which don't fall in the cigarette butts, cigarette packaging, e-cigarette, marijuana packaging. And in those 105 others, 64.8 were actually nicotine pouches that were found in that other category. Campus B had 37 randomized scans, which led to 1,280 total TCW products being collected. And of that number, 1,219 were cigarette butts. In our reported scan findings, Campus A had 100 reported scans, which resulted in 1,636 total TCW products being collected, and the majority of them, 1,361, were cigarette butts. And we did have a finding of 151 other, and again, similarly like to the randomized scan findings, 68.9% of that other category were actually nicotine pouches. And in Campus B, they had 162 reported scans, leading to a total of 2,141 TCW products being collected, and 2,067 were cigarette butts, that containing the majority of the total products being collected. Some factors to explore to understand the differences in TCW found on those campuses. Local access to nicotine, tobacco, and cannabis products could be a factor, as well as regional differences in the enforcement of tobacco policies. Some conclusions that we have is smoke and vape-free universities are still being impacted by TCW as found in the reported scans and randomized scans, and continued enforcement of these policies are required. New verbiage may be necessary to keep up to date with the influx of new products on campus. And then this study was funded by the TRDRP, and a special thanks to Tom Novotny and California Youth Advocacy Network for their contributions, and our references can be scanned with the QR code below. Thank you.
My name is Maria Cristina Huertavila, and my research was on the effect smoking policies have on tech waste discarded in the environment. Tech refers to T for tobacco, E for electronic or e-cig, and C for cannabis. Tech waste, especially cigarette butts, have been recognized as significant sources of environmental pollution. Cigarette filters are the single most littered item in the world. They are made of cellulose acetate, a non-biodegradable plastic which decays into microplastics and can leach toxic chemicals into the environment. This case study set out to investigate the amount and type of tech waste discarded in two adjacent business properties. These business properties have different smoking bans, with Building A having a property-wide no smoking policy except for in a designated area, and Building B, which allows smoking and has multiple ashtrays located around its building. We surveyed all blacktop, landscape, and sidewalk areas for tech waste by using a snowplow method, which included teams of 3 to 4 research assistants who walked side by side to survey all areas, being careful to look through all debris and leaves to make sure no data was overlooked. These items were photographed, geocoded, categorized through a smartphone app, and all waste was picked up. We found in both buildings the largest amount of tech waste were cigarette butts. For Building A, despite signage regarding the property-wide smoking ban, there were large amounts of tech waste items, mostly discarded on the sidewalk and in the landscape areas. For Building B, despite the availability of ashtrays around the building, it had 39% more cigarette butts than Building A. Building A had a higher proportion of cigarette butts discarded on sidewalks than Building B, and Building B had more cigarette butts discarded on the landscape areas than Building A. We concluded that a property-wide smoking ban, signage, and a designated smoking area may have contributed to lower tech waste around Building A, and instead of smoking on the property for Building A, smokers may have moved to the sidewalk and discarded cigarette butts there. Given the widespread distribution of cigarette butts, additional ashtrays are unlikely to offer a feasible solution. Building B's existing ashtrays appear to be an ineffective strategy to prevent tech waste in the environment around Building B. Limitations for the study are that even though we compared two properties of similar size, layout, and landscaping, these two buildings house different types of businesses which might attract different foot traffic and might include people who differ in smoking behavior. Research could examine the reasons for disposing of cigarette butts improperly, the content and positioning of signage, and how knowledge of environmental harm and smoking policies affect compliance with policies. Different landscaping and smoking area layout could test compliance levels of smokers, and experiments should be conducted on how to prevent tech waste from being discarded in the environment. Furthermore, efforts are needed to educate on the importance of reducing the negative impact of tech waste and its harm to the environment. Finally, since cigarette filters have no health benefits, a complete ban on cigarette filters should be considered.
Hello, my name is Oscar Lopez and I'm going to share this project, Tear Smoke in Homes, Fate, Characterization and Remediation. Tear smoke is a persistent toxic residue that attaches itself to various household materials such as clothing, toys, and furniture. Exposure can occur through physical contact, breathing, and ingestion, leading to health risks including respiratory issues and cancer. Our objective is to investigate the distributions and level of pollutants of THS residues in different furniture and assess how deep these pollutants can travel within indoor environments. For our study, we recruit participants who were current smokers and had smoking indoors for at least 6 months. We collect THS polluted materials like carpet, drywall, and cushion furniture from their homes. Advertisement in the San Diego Reader and eligibility screenings help us to recruit participants. Those participants provide demographic data and smoking habit through questionnaires and were compensated monetarily for replacing their THS affected items. To detect nicotine, we use wetted cotton rounds with 0.1% ascorbic acid for surface wipes. This stabilized the nicotine, ensuring accurate analysis. Those samples were collected in different homes areas based on smoking habits. The samples were sent to the lab for precise nicotine levels detection. Homes with high nicotine levels received further visits for furniture replacement. For fabric, from various furniture sections were gathered layer by layer. We plan to visualize how deep the nicotine can penetrate different surfaces using the collected information. Our findings show that nicotine concentrations were high under furniture, likely due to infrequent cleaning. Also, smoking outside the home significantly reduced the indoor nicotine levels. We observed that nicotine concentration varied across different layers of the samples, with the highest concentration in the topmost layer. In conclusion, smoking outside the home significantly reduced the indoor nicotine levels. Longer Smoking history and neglect of cleaning practice are associated with elevated nicotine levels. Our data provide an overview of nicotine distribution with different samples layers, laying the groundwork for further research and analysis. Thank you for listening.
Hello, this is Tom Navani. I'm a professor emeritus of epidemiology and biostatistics at San Diego State University, and I'm presenting a poster done by a team that I led over the last 3 years, funded by the California Department of Public Health, to address the economic and environmental impacts of tobacco product waste. What we know is that even though smoking prevalence has declined, there's still a lot of smoking going on and a lot of cigarette butts that end up in the environment. There's about 2 billion cigarette butts that are dropped into the California environment every year. So this is not an insubstantial amount of waste. So somebody has to clean it up, or at least think about what the potential cleanup is and how much it costs. So what we tried to do was to construct some estimates about the total burden of tobacco product waste, mainly cigarette butts, and then to put some cost estimates to the potential cleanup costs and what this might be as a burden to taxpayers and citizens in general, perhaps businesses as well. We know that this waste is toxic in large part, not only because of the chemicals distributed from the discarded cigarette butts, but also from the microplastics that might be there. There's still a lot of research to be done as to what the human health effects of the substantial amount of microplastics that end up in the environment might be related to. What we do know is that everything costs money, cleanups cost money. We developed 3 methods of trying to estimate TPW abatement costs. One is a proportional measurement, meaning trying to figure out what the proportion of costs such as street sweeping or cleanups or even wastewater management are that might be attributed to cigarettes and tobacco product waste. There's a sales estimation, sales volume estimation method that we looked at. We purchased sales data for the San Diego market at least to estimate the cost of what might be a percentage of that cigarette sales that end up in the environment. And some estimates go as high as 60%, some are lower, but somewhere between 20 and 80% of cigarettes are dumped in the environment, whether by the smoker or through the landfills, which have a cost associated with that management. And then finally, there's a statistical estimation technique where we're able to actually get real data in terms of person hours and also estimated prevalence and numbers of cigarettes smoked in a particular area to come up with a person time estimate of at least the surface abasement, that is sweeping up, cleaning up, that would be necessary to get rid of the amount of tobacco in that particular environment. So that would be a statistical model that might be applicable across the state, given what we've been able to identify. Based on a set of cleanups done by Professor Matt's group at SDSU, we've been able to estimate what the sort of time element for a single item of tobacco product waste costs in terms of hourly wage for the number of people out in the environment cleaning up. And this is on a 1 episode basis. What we want to try to do is translate that into what the burden might be over a year, for instance, whether it's picked up twice or 3 or 4 times. But nevertheless, what we have is at least a good sense of what it costs in terms of person time at the given wage in the county at about $16 an hour. So we have some preliminary data, and the results are presented in the table, preliminary comparison of methods. And again, this is not for publication, but it gives us a sense of where we kind of stand. And it's not inconsistent across some other studies that we've done in terms of large city tobacco product waste burdens. In San Francisco, or rather in San Diego, a proportional estimate ends up costing about $3.62 a pack that is smoked in the San Diego area per year to do mitigation, and this is primarily service mitigation. The sales volume estimate comes out at about $4.83 per pack sold in the area again, And then our statistical estimation is quite a bit higher because we're actually getting real data from physical activities to clean up the cigarette waste in 60 census tracts, census blocks rather, that were selected randomly and then became a field enterprise to clean up on 2 different occasions. And interestingly enough, after about 6 months, the amount of tobacco product waste that was picked up from the first was pretty similar to the second cleanup activity. So we have a pretty good sense that this is kind of a steady state equilibrium in terms of tobacco product waste. So what this does is it allows us to at least move forward with further research on how to apply the statistical model, compare it to other methods of estimating costs, and yet we still have a lot of other work to do, meaning other sources of cost, that is systems maintenance, where sewers and wastewater treatment are affected by tobacco product waste, as well as ecosystem service losses, that is the disability of the ecosystem resulting from tobacco product waste over the years. And we don't know what the impacts of that are yet, but it's true that there have been billions and billions of cigarettes dumped into the environment over the last 50 to 60 years, much of which is plastic waste from the cigarette filter. So this economic estimate allows us to then support policies that might actually reduce that waste upstream by changing the product, by creating more smoke-free places, and by perhaps even exacting either litigation or tobacco product waste fees on the tobacco industry to pay for the cleanup. Thank you.
The basis of our project regarding smoke-free outdoor dining had 3 key research questions. First, how do San Diego County residents respond to or perceive the idea of smoke-free outdoor dining in restaurants? Second, how many restaurants in the city of San Diego have outdoor dining areas, and of those, how many have smoke-free policies in those areas? And third, how much nicotine is present on the hands of diners eating in smoke-permissive outdoor dining areas, and how much nicotine is on the surfaces they eat off? To answer our first question, we utilized a Qualtrics survey distributed to California residents that asked them numerous questions revolving around the subject matter. Most notably, they were asked if they would support a law that bans smoking in outdoor dining areas in the city of San Diego. In order to identify San Diego County residents, these participants were also asked to give their zip codes. To understand the restaurant census, we gathered a list of every single restaurant in the city of San Diego by downloading a master list of business licenses from the Office of the City Treasurer and identified 1,898 businesses labeled as restaurants under 6 different classifications. We then separated these businesses by their classification, randomized them within their strata, and sampled them equal to the proportion of the total restaurants in San Diego. For example, restaurants labeled as full service took up roughly 39% of the total number of restaurants, so we sampled 39% of full service restaurants. 300 restaurants were called to ask if they had outdoor dining, and if they said yes, whether or not they would allow the caller to smoke in this outdoor dining area. To measure the levels of nicotine on the eating surfaces in the diner's hands, 10 restaurants were environmentally sampled for nicotine. 5 allowed outdoor smoking, while the other 5 prohibited it. 2 research assistants were sent to each restaurant to perform surface and hand wipes for nicotine. 1 research assistant would also wear an Atmo air quality detection tool. As of the data present for this symposium, we currently have data for 221 San Diego County residents in our survey, but we are looking for at least 250 total responses from San Diego County. From our restaurant census, we found that of our 300 restaurant sample, 171 had outdoor dining. Of those outdoor dining, 36% said they allowed smoking, 58% said they didn't, and 6% had unclear policies regarding smoking in outdoor dining areas. As of now, all of our environmental sampling has been conducted, but the results are currently pending. Our next steps for this project are reaching our quota for survey responses, compiling our restaurant census data to present to policy influential groups, and interpreting our environmental samples to illustrate the lingering effects of smoking on other non-smoking patrons.
My name is Savannah Yurchak.
And I'm Kaylee Quesada.
We're Stay San Diego interns working with the Policy Research Center, and we are going to talk to you today about the disclosure of third-hand smoke in real estate transactions.
Thank you, Savannah. Yeah, so just to start off, third-hand smoke, as a definition, it's the chemical residue left behind by second-hand smoke that remains on surfaces and within environments where tobacco is used. So within the home, that can remain on walls, within flooring, etc. It's very harmful to human health. It's very hazardous and very difficult to remove within the home. It poses a risk to new homeowners and home buyers who could possibly purchase a property polluted with third-hand smoke, and again, they would not be aware of it. Unlike other environmental hazards such as asbestos, formaldehyde, and lead-based paint, third-hand smoke is not as required to be disclosed in the state of California. The language around it is very weak currently, and so we would really want to focus on strengthening that language and strengthening the mandate to require the disclosure of third-hand smoke within a home. We also want to include third-hand smoke in any educational documents that are provided to potential home buyers throughout that process, and really make them aware of the effects and possible the harmful effects of third-hand smoke on their residents and their families.
So, for our rapid response research project, the best way that we can support advancing, a policy like this would be to determine what the possible impacts of a policy requiring mandated disclosure and the classification of third-hand smoke as an environmental hazard would be. And the way that we plan to do that is to survey realtors in California, as well as do some focus groups with other key stakeholders like home inspectors and independent real estate agents. And so our plan to do that is to review existing studies, find those key stakeholders, design the questions we want to ask them, recruit those participants, and then use those findings to educate the community, train our community partners, and then use that to inform those discussions with decision makers where people are advocating for the mandatory disclosure of third-hand smoke. And another disclaimer is that all the steps in this process will be reviewed by our community advisory board as well as our community partner work group. So what we've done so far is we've identified and established some relationships with those stakeholders. We've talked to some people in those stakeholder groups, as well as found possible partner organizations like the California Association of Realtors and potentially the San Diego First Time Home Buyers Program to help us get in contact with some participants to participate in our study. We've reviewed some current disclosure policies and existing surveys. We've reached out to some researchers who've done similar work. Dr. Klassen has actually sent over, from Drexel University, she sent over some of her survey questions that she's used, which we could use as inspiration to help create our own survey. Right now, what we're in the process of doing, the step that we're doing right now, is creating our own survey, creating focus group questions, and creating those recruitment materials like flyers that will help us get participants. And so our next step that we plan to do is to run all of that by our community advisory board and community partner work group and really see what they think.
This project is on establishing a smoke-free policy in a tribal campground. It's a rapid response project through the Policy Research Center at Center for Tobacco and the Environment through San Diego State University Research Foundation. To start off with, I'll introduce myself, Michael Vangello, and I have the help of John Dale Noriega, Jennifer Geisler, Rachel Reef, Tom Novotny, Jorg Matt, Lydia Greiner, and Paula Stigler-Granados. To start off with, I'd just like to introduce the campground. It's the La Jolla Indian Campground in Palma Valley, California. It is tribal land and something that we keep in mind whenever we do work out there, just to have respect for tribal practices and some ceremonial tobacco and the differences between that and commercial tobacco. Basically, the goal of this project is to eliminate commercial tobacco and tobacco product waste associated with it. It's a really interesting campground with a lot of amenities, including camping, RV camping, group camping, river tubing, mountain biking, zip lining, a splash pad, and a water park. It basically has a river running right through it. So it's really important to be cognizant of the tobacco product waste around there as it leaches directly into the river there. It's open year-round, but the busy season is really between Memorial Day and Labor Day, so basically during the summer. The campground's not yet smoke-free, but we're working with the tribe towards implementing a smoke-free policy, along with our partners Rachel and Jen at the La Jolla Tribal Tobacco Reduction Program. So the problem is that tobacco product waste and smoking and vaping are causing negative impacts among campers and tribal members that complain of smoking, secondhand smoke coming from other campsites, as well as tobacco product waste left over from previous campers that kind of ruins the experience for campers and tribal members. So one of the goals for us is just to gauge opinions, knowledge, attitudes, behaviors of campers and tribal members, as well as the campground staff. So we came up with 4 different surveys. The camper survey is now developed, and you can use the QR code at the bottom of the poster to take that survey. That would be a big help to us to sort of get responses and opinions about how it goes, and we can still tweak it at this point. We also did tobacco product waste data collection. We did round 1 in the winter of 2023 before the campground started putting out signs, no smoking signs, as you see there, no vape, smoke, and the campground is a tobacco-free facility. They're discouraging people, obviously, from using smoking and vape products, as well as smokeless tobacco. So we did data collection there and found 233 tobacco product waste items, including 217 cigarette butts, which is 93% of what we found. We'll do another pickup after the summer of 2024, like I said, the busy season. And so yeah, we've also regularly engaged with the community over this. So like I said, we've met regularly with the La Jolla Tobacco Reduction Program on a bi-weekly basis, but we've also worked with the La Jolla Tribal Youth Program. We'll attend a summit of theirs in August and sort of help educate young people on the risks of tobacco product waste, smoking, and vaping, especially. And you see the pictures here from Earth Day, where we talked about the work we were doing in the campground. And this event was actually in the campground. We also did a Martin Luther King Day of service cleanup there. And we'll continue to work with the youth program to help administer surveys working towards the future. We're going to present these results to Tribal Council and sort of help advise on the next steps moving towards a smoke-free policy. We'll evaluate how effective the signage has been and also the smoke-free information on their website to see if they had any impact. The surveys will help gauge that, and we want to obviously help reduce the amount of tobacco product waste in the campground. So the results of our data collection will help inform that. We'd like to see denormalized tobacco use, heightened awareness around environmental harms, and encourage upstream solutions to help eliminate tobacco product use and the waste associated with it. And we'd like to just continue this ongoing partnership with the tribe, help advise and guide them, but also get a lot back from them, from attending community meetings and having their input. And we like this back and forth relationship and hope to continue it. That's all I have. Thank you so much.
The Policy Research Center for Tobacco and the Environment has 6 planned policy initiatives. The first 3 initiatives are already underway and have their own posters at the symposium today, and I am presenting the other 3 upcoming initiatives. The first is to protect aquatic environments from urban tobacco product waste. Tobacco product waste that is littered on the streets and sidewalks of San Diego County gets flushed into waterways when it rains. Once it is in our waters, the waste breaks down into microplastics and releases chemicals into the water. We are conducting 2 rapid response projects, or RRPs, for this issue. RRPs are short-term research projects to answer questions related to each initiative. For our first RRP in this initiative, we are recording tobacco product waste before a rainstorm on the sidewalks and streets that feed into the Noyes Street drainage basin at the Kendall Frost Mission Bay Marsh Reserve. After the rainstorm, we will take water samples. Protecting this reserve is important for native species in the area, such as the Ridgeways rail that's on the poster. Our second RRP is recording tobacco product waste and water samples weekly for 4 weeks in the drainage basin. After these RRPs, we will have maps of tobacco product waste in the drainage basin, narratives and graphics of the water samples, and presentations of our findings for San Diego environmental and urban planning groups. Our second policy initiative is to disclose third-hand smoke pollution in lease agreements. The state of California does not require property managers to disclose to potential tenants if there was or still is ever smoking in rental units. This can force tenants to be exposed to second and third-hand smoke. Our RRPs for this initiative involve asking property managers, local trade groups, and city council members their thoughts on second and third-hand smoke disclosure. We will also ask residents and tenants their thoughts on second and third-hand smoke, as well as review disclosure policies in other jurisdictions. This initiative will produce infographics of the survey and interview results and presentations for property management and tenant and housing advocacy groups, educational materials for both property managers and residents, and model language to help get third-hand smoke included in disclosure documents. Our third policy initiative is to promote restorative practices as an alternative to suspension for students caught smoking or vaping in the San Diego Unified School District. Suspension tends to not help students quit using tobacco products, yet it is one of the most common consequences for students caught smoking or vaping. The first two RRPs for this initiative are to interview parents and students about current alternatives to suspension, and to ask students, parents, and faculty at schools with restorative practices about their experiences with the practice. The third RRP is to host a community workshop to discuss how to make an effective restorative practice that includes information on the environmental impact of commercial tobacco use. This initiative will produce reports of interview results, presentations for schools and tobacco control programs, guidelines for restorative practices, and guidelines for other schools to host a community workshop like we did in our third RRP. With all of the three of these policy initiatives, we hope to use our results and deliverables to help educate stakeholders and drive policy change to protect our communities from tobacco pollution in indoor and outdoor environments.
The mission of the Policy Research Center is to conduct community-driven tobacco policy research that leads to a cleaner and healthier indoor and outdoor environments in San Diego County by eliminating the toxic legacy of commercial tobacco products. We are fostering community connections and enhancing community engagement through a community-based participatory research approach. This research method ensures that community members, researchers, and stakeholders work together as equals, drawing on one another's strengths, experiences, and expertise. We have two vehicles to meet the needs of our communities: the Community Advisory Board, which is short for CAB, and the Community Partners Work Group. The CAB is a group of representatives from 13 different organizations across professional and community sectors, each bringing unique perspectives. Additionally, they provide oversight and guidance regarding the rapid response projects. Our Community Partners Work Group consists of community members from San Diego, as well as representatives from various communities organizations. Members of the CAB also participate in this work group. Each quarter, they receive teaching segments aimed at equipping community members with the tools needed to effectively advocate and raise awareness about the impact of tobacco. The community partners and CAB are the heart of this project. Not only do they identify community concerns, but they are also involved in this every step of the way of the research process, from project creation to data collection, evaluation, and dissemination.
Hello, my name is Emily Carrillo, and today I will be presenting my poster on the Third Hand Smoke social media toolkit. A little introduction to third hand smoke. A third hand smoke is a chemical residue that is left behind on clothes, skin, furniture, walls, and other surfaces after smoke has cleared. Third hand smoke is also known as tobacco smoke residue or stale tobacco smoke. The mixture of pollutants in third hand smoke is toxic to humans and especially in children. This toolkit is a collection of resources and materials designed to make educational resources publicly available of use by other tobacco control and prevention advocacy groups, as well as individuals to raise awareness about third hand smoke. So, what's in the toolkit? In the toolkit, we'll find overview posts, awareness days posts, and pre-written post captions and hashtags. In the overview posts, we have educational graphics that disseminate third hand smoke research, such as third hand smoke fact or fiction images, what products contribute to third hand smoke so our audience is able to identify, and what is third hand smoke. Awareness days posts, we have content for awareness days like World No Tobacco Day, Great American Smokeout, and Earth Day. We also have pre-written post captions and hashtags, and this means with each post we have ready-to-use captions and corresponding hashtags. For example, the third hand smoke hashtag, smoke-free homes hashtag, tobacco endgame, and Kick It California. And here at the bottom left, we have a little image with an example of how it looks in the toolkit. This one is promoting smoke-free housing policies. And moving on, how do I use the toolkit? So when going through the toolkit, choose a post that is going to be more suitable to your audience's needs and interests. Next, we want to find the post that we like and download the post as a PNG for the best quality. Next, we can create a caption. You can use a provided caption from the toolkit, or you can create a unique caption that explains the post content to your audience if they haven't been introduced to third hand smoke yet. Next, we can add hashtags. You can include the suggested hashtags from the toolkit to connect with your audience or expand the larger audience and create some unique ones. Also, don't forget to tag us on Instagram, Facebook, and TikTok. Instagram at thirdhand_smoke_resources, Facebook, the Third Hand Smoke Resource Center, and TikTok at Third Hand Smoke Resources. And lastly, you can access the toolkit by going through our website at thirdhandsmoke.org, and it will be under the Resources tab. You can also scan the QR code below to take you right to the toolkit to download.
Tobacco, e-cigarette, and cannabis waste contributes to non-biodegradable and toxic waste. This waste accumulates on streets, parks, and beaches, causing carcinogens to leach into soil and water. Tech waste is acutely toxic to aquatic organisms and can bioaccumulate and biotransform within the human food chain. This study aims to develop a smartphone app for community members to become citizen scientists to monitor data on tech waste, raising awareness and support for tobacco control policies. From October 2022 to January 2023, volunteers from partner community organizations provided regular feedback to inform and develop the app. Beginning in December 2023 through April 2024, these community organizations recruited a convenience sample of 50 adults to field test the app. Volunteers completed pre- and post-test online questionnaires to measure knowledge, attitudes, and behaviors regarding tech waste, app usability, features, and subjective appeal. Volunteers monitored tech waste with the app in their neighborhoods for 1 month, about 30 to 60 minutes per week, after completing a virtual training session on how to use the app. Preliminary results based on user experience of the first 36 participants who completed field testing are shown on this poster here. Volunteers recorded a total of 3,971 tech waste items in 1,913 observations. 97% of these items were cigarette butts. While feedback during field testing was associated with technical issues for loading and submitting observations, post-survey responses indicated a high level of confidence using the app. Most agreed that they could learn to use the app relatively quickly and that the layout appears well structured. The majority of users rated the submission of observations and the tobacco product waste identification guide as very or extremely useful. Overall, users expressed satisfaction with the app's features and visual aesthetics. Preliminary results highlight the potential for citizen science to support tobacco control policies and that would reduce tech waste. Developing the smartphone app with input from diverse community groups and residents create a collaborative space for community advocacy. User feedback during field testing will inform final modifications to the app before wide dissemination to the general public through tobacco and environmental advocates.
All right, so this is the poster for measuring tobacco product waste in San Diego County. Our goals for this project were to investigate the amount and distribution of waste that was generated by commercial tobacco, electronic cigarette, and cannabis waste in San Diego County. We also aim to determine the amount of reaccumulation of commercial tobacco, e-cigarette, and cannabis waste, and assess the factors that contribute to the distribution of tobacco product waste, like land use and smoking behavior. We also aim to use this data to inform policies aimed at mitigating the environmental harm caused by these waste products, and also educate and involve community partners to brainstorm effective solutions to reduce or hopefully eliminate tobacco product waste. Now, tobacco product waste is a global problem. This waste includes cigarette butts and other waste from tobacco, electronic cigarette, and cannabis products. Carcinogens from this waste can leach into soil and water for years to come. And the cigarette filters themselves are made of a non-biodegradable plastic called cellulose acetate, and are the single most littered plastic item in the world. These filters can take years to degrade, breaking down into microplastics that can enter our food chain. So in order to assess these issues, We selected the 8 largest cities in Southern California for data collection. Across these 8 cities, we selected 60 census blocks to visit at 2 different times. We trained volunteers and staff to participate in this data collection, and these volunteer and staff would geocode tobacco product waste to create neighborhood maps of the waste distribution. On top of this, we also identified factors that contribute to the distribution of tobacco product waste and use this data to brainstorm with community members to reduce or eliminate tobacco product waste. The results of our studies showed that we found approximately 30,000 tobacco product waste items across all 60 census blocks, and this projects approximately 9.5 million tobacco product waste items in all public areas of the 8 cities. Another important finding was that we noticed that land use does matter. Census blocks with retail, entertainment, or parks have much more tobacco product waste than residential-only blocks. Unfortunately, cleanups alone are not effective in tackling this tobacco product waste, but they can be effective in raising public awareness. Another thing that we found was that tobacco product waste reaccumulated very quickly, with 90% of the waste reaccumulating in just 2 months. Next steps for this project are to work with elected officials, city managers, environmental organizations, businesses, tobacco prevention groups, and other community partners to design and implement midstream and upstream solutions, such as restricting the sale of commercial tobacco or reducing the production of commercial tobacco products.
Hello, my name is Nafisa Ferdos. I'm a postdoctoral research scholar at the Center for Tobacco and the Environment and the principal investigator of the pilot project titled "Do Policy Roundtables Promote Third Hand Smoke Initiatives in California Tobacco Control Efforts?" This pilot project is funded by the Policy Research Center for the Tobacco and the Environment, and through my poster, I will be introducing the study and providing an overview of the research aims and methodology. The California Tobacco Prevention Program, in short CTPP, collaborates with 61 local lead agencies and numerous competitive grantees comprising of community-based organizations receiving funding for projects, and together they address tobacco-related challenges comprehensively. To aid in advancing third hand smoke efforts locally, the Third Hand Smoke Research Center hosts virtual policy roundtable discussions bi-monthly with California Tobacco Prevention Program members to cultivate innovative tobacco control policy discussions around third hand smoke. This Third Hand Smoke Policy Roundtable series is a pioneering effort to provide a space to shed light on third hand smoke issues and facilitate networking and idea exchange among participants from various organizations involved in tobacco policy efforts across California. The roundtable discussions delve into various policy realms concerning third hand smoke exposure. Some of the topics we have covered and explored include third hand smoke in healthcare settings, in multi-unit housing, in workplaces, as well as residual third hand smoke from electronic cigarette use, and third hand smoke contamination between neighboring businesses, as well as third hand smoke presence at smoke-free outdoor dining services. We host the policy roundtable via Zoom and follow a structured format. We start off with a presentation focusing on a specific topic of third hand smoke. Then participants are divided into smaller breakout groups where they brainstorm and respond to discussion questions specifically designed to address policy areas related to the presented topic of third hand smoke. Following the brainstorming session, we reconvene for an interactive discussion. To facilitate this, we utilize Jamboard, an interactive digital whiteboard, where each group can post and share their insights and responses, fostering a collaborative exchange of ideas. Evaluating the influence of third hand smoke policy roundtables on California's tobacco control landscape will shed light on the implications of providing technical support in a formalized setting to tobacco control groups regarding third hand smoke. This pilot study adopts a qualitative approach to achieve this objective. The aims of the pilot project are to assess the degree to which policy roundtables promote third hand smoke awareness among participants and evaluate the extent to which they influence third hand smoke initiatives across CTPP funded projects and local lead agencies. For participant recruitment in the pilot study, we'll initiate participant recruitment by compiling a list of approximately 180 contacts from 2 CTPP directories, the competitive grantee contact list and the local lead agencies contact list. To be eligible, individuals must have attended at least one of the 13 policy roundtable meetings we have done so far. We will screen all contacts using a Qualtrics software-based screening survey. The screening survey will be distributed via email and include items from the Third Hand Smoke Knowledge, Attitude, and Behavior, in short KAB scale. Additionally, participants will have the chance to enter a raffle for a $200 Amazon gift card upon completion of the screening survey. For our first aim, we will conduct semi-structured interviews via Zoom using an interview guide with open-ended questions. These qualitative in-depth interviews will explore participants' understanding of third-hand smoke, their insights from the roundtable discussions they have attended, and potential influence of these discussions on third-hand smoke policy efforts within their tobacco control agenda. Each interview will aim to capture key takeaways, networking experiences, policy alignment perspectives, and areas for improvement. We aim for a sample size of 15 to 20 participants determined by saturation principles. Interviewees will receive CTE merchandise, that is Center for Tobacco and the Environment merchandise bundle, for their time participating in the study and giving the interview. The second aim of the study is web content analysis, and for that we plan to employ a qualitative content analysis approach to examine the websites of California Tobacco Control Program funded projects and local lead agencies. These websites belong to all the organizations and local lead agencies invited to the policy roundtables. The goal is to assess integration of third-hand smoke content and communication strategies on these platforms, which include third-hand smoke-related textual and other multimedia elements, resources such as infographics, fact sheets, and other community engagement efforts on the website platforms. Qualitative interviews will be transcribed using Zoom auto-transcribing feature and further validated by the project PI, which is myself. We will use in vivo software for thematic data analysis. Web analysis will follow manifest analysis surface structure steps to assess third-hand smoke integration on project websites. In summary, this qualitative evaluation of the third-hand smoke policy roundtable will determine how extensively tobacco prevention advocates include third-hand smoke in their materials, education, policy strategy, and scope of work. Identify facilitators and barriers to the inclusion of third-hand smoke in local initiatives across California, as well as identify specific areas for improvement in future roundtables based on insights gathered from participant interviews and web content analysis. So that is, in a nutshell, the pilot project. And before I end, I want to acknowledge the Policy Research Center again for funding this pilot study, and I want to thank you all for your attention.